Yeah, and you're really centering in on a lot of those kids who have perfect sight, but then have underlying binocular vision or accommodation dysfunction issues. They might have some ocular motor dysfunction. So, layman's terms, they might have issues with tracking, with convergence, and with focusing. And for some kids, a smaller proportion, they're going to have difficulties with visually processing and integrating that visual information with what they're getting from their other senses. And so, naturally, if kids find something difficult or they're not understanding it, then they're going to either have concentration problems or they may learn that those particular tasks are difficult. So they opt out and they start opting out before they've even started. So it becomes this kind of almost like a pattern.
So what may look like a motivation problem could actually be a comfort problem where kids are just avoiding something that just feels uncomfortable for them.
Yeah, yeah, and I'll often talk to parents about there are two categories of symptoms, and I think we've mentioned this on other videos that we've done. Loosely, you talk about what we call eye-related symptoms and then performance-related symptoms. So, eye-related symptoms are those things where I can have a discussion with someone who's not an optometrist and go blur, double vision, sore eyes, tired eyes, headaches. We would probably agree that that makes you a bit suspicious of a vision problem. Whereas if we go performance, it's like can't concentrate, having problems with attention, losing their place with reading, avoiding, not enjoying, those sorts of things. And you can start blaming that on lots of other things like attention, behavior, interest, those sorts of things, when quite often it can actually be driven by a vision problem, wholly or in part.
So you mentioned tracking before. So just to clarify, that means like kids are struggling to read one line to the next. Is that what you mean?
Yeah, and I'd like to break that down to parents that we can have a tracking symptom, which is that losing place, not being able to kind of keep check on where you're going with your writing. And you can have a tracking problem, which is a measurable issue with how well you've developed your eye movements,
Mm.
whether it be what we call as pursuit eye movements, which is the smooth ones, or a saccadic eye movement, which is our jumping eye movements.
So you mentioned something important there. I think is when I'm thinking about this, the first thing I think of is reading issues, but you actually mentioned writing as well. So are you saying that these kind of functional vision problems can affect kids with their motor skills or their handwriting at least?
Absolutely. I mean, there's a critical link between fine motor skills and your visual system and being able to execute. And if you think about it, and we do see this sometimes, is we'll have kids who have learnt to read fairly efficiently and they're really good readers, kind of sampling the text. They're
Mm.
looking for the cues that tell them about what the author's trying to tell them. So they're not in the decoding phase anymore. They're not having to look at all the various parts within a word and then perhaps not even looking at every single word to be able to get the author's message. But if you shift across to writing, you cannot avoid being interacting with every single letter, every
Right.
single word, spacing, and all the rest of it. So it can be a lot more visually demanding. And so you might get this child who has this kind of excellence in reading, but the spelling doesn't sort of add up to the same degree. But you also get into things like spatial awareness. So kids who may not really be able to judge space very well don't have an understanding of where to start on the page. How much room have I got? The kids who start too far into the page and then run out of space and start writing the letters smaller or turning down the margins as they write.
So do teachers often notice these signs before the parents do? Because I imagine, they see a lot more evidence of their struggles with reading and writing.
Yeah, absolutely. And sometimes there's also, you'll occasionally get a difference where parents will, the teacher will notice something, but the parents haven't seen it because in a one on one situation at home, the kids don't have then the additional having to filter out noise in the
Mm.
classroom, the other sort of distractions. And teachers are well versed, obviously, on getting a sense of expectations on what a child at a certain grade or age level should or shouldn't be able to do. And so they can be particularly good observers. And we'll often, those questionnaires that we send out to parents, will often send out a separate one for teachers to fill in so that we can kind of get a judgment on, the home situation versus the classroom situation.
And I guess a lot of, kids at home, they're not often reading things on a whiteboard or a blackboard across the room, are they? So it's a different kind of environment.
Yeah, and they're able to sort of work to their own level sometimes rather than sort of being stretched like they might be in the classroom.